Hi, I'm Dr. Fred Echols, Acting Director of Health for the City of St. Louis. COVID-19 vaccine distribution efforts continue in the City of St. Louis and across the world. Some leading reasons reported by adults who have been vaccinated by the Department of Health and our partners include previously experiencing severe COVID-19 complications requiring hospitalization, death of family members who were infected, wanting to return to work and children returning to school, feeling safe around others, and simply returning to normal life. This week's questions from the public focus on COVID-19 vaccines. Deborah from zip code 63115 asks, are the COVID-19 vaccines being used in the U.S. effective at preventing COVID-19? Existing data collected from clinical trials show that the Moderna, Pfizer, and Johnson & Johnson vaccines that have been approved under the FDA's Emergency Use Authorization Authority are effective in preventing severe COVID-19 complications, including death and hospitalization. The vaccines are important tools to save lives and help end the pandemic. The Centers for Disease Control and Prevention recommends you get a COVID-19 vaccine as soon as one is available to you. For more information, please visit the City of St. Louis Department of Health's COVID-19 vaccine information page at stlouis.mo.gov/COVID-19/vaccine. Sharon from zip code 63113 asks, can people who are fully vaccinated still become infected with COVID-19? No vaccine is 100% effective. As long as there is continued community transmission of COVID-19, there is a chance that some people who are fully vaccinated will become infected and get sick. Health and safety measures such as wearing a face covering and social distancing remain important in preventing the spread of SARS-CoV-2, the virus that causes COVID-19. Public health and medical officials continue to monitor and evaluate how often breakthrough COVID-19 cases occurs, how severe the illness is, and how likely the vaccinated person is to spread COVID-19 to others. Bernard from zip code 63120 asks, is it okay to get the Johnson & Johnson COVID-19 vaccine? The Food and Drug Administration and Centers for Disease Control and Prevention have lifted the recommended pause on the Johnson & Johnson COVID-19 vaccine after thorough safety reviews. Both agencies underscore confidence in the vaccine's safety and effectiveness following a data assessment. Available data suggests that the potential blood clots that were reported for the agencies to implement the pause are very rare events. The surveillance systems that are in place to monitor the safety of COVID-19 vaccines authorized for emergency use are working, as demonstrated by both agencies' quick work to identify and investigate these rare but serious adverse events. The FDA and CDC will continue with these efforts to closely monitor the safety of these vaccines. As we continue to move through the COVID-19 pandemic, the City of St. Louis Department of Health will continue to make sure City of St. Louis residents have access to accurate information. If you are interested in receiving COVID-19 notifications from the Health Department, please text STL-COVID, that's STL-COVID, to 888-777. As critical information becomes available, we will send out the information to the community using our Notify STL platform. Thank you for tuning in this week, and thank you to Deborah, Sharon, and Bernard for submitting questions. Be sure to tune in next week for more critical public health information. I really want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well.